Performing a urinalysis with a dipstick is a common and important clinical procedure, used to screen for and diagnose a wide range of conditions, from urinary tract infections to kidney disease and diabetes. The process involves several key steps to ensure the sample is collected and tested accurately. Here are the general clinical steps to perform a urinalysis dipstick procedure. 1. Preparation and patient identification. Gather equipment. Ensure you have all the necessary supplies, including a urine sample in a labeled container, a new dipstick from a container that is not expired, gloves, and a timer or a clock with a second hand. Verify patient details. Always confirm the patient's identity and match it with the information on the urine sample container to prevent errors. Don PPE. Wear appropriate personal protective equipment, such as gloves and possibly an apron, as you will be handling a biological sample. 2. Visual inspection of the urine sample. Before you even use the dipstick, visually inspect the urine itself. Note its color. Normal urine is typically a pale yellow or amber color. Abnormal colors can indicate dehydration, certain foods like beets, medications, or underlying medical conditions. Clarity, turbidity. Normal urine is clear. Cloudiness or turbidity can be a sign of infection due to the presence of white blood cells. While not always done, a strong or unusual odor can be noted, such as a sweet odor for diabetes or a fishy odor for a UTI. 3. The dipstick procedure. Remove a dipstick. Carefully take one dipstick out of its container, making sure not to touch the chemical reagent pads with your fingers. Immediately recap the container to protect the remaining strips from moisture and light, which can affect their accuracy. Immerse the dipstick. Briefly and completely immerse all of the reagent pads into the urine sample. Do not soak it for an extended period. Remove excess urine. As you pull the dipstick out of the sample, run the edge of the stick against the rim of the container to remove any excess urine. This prevents the chemicals from one pad from bleeding into another, which could lead to inaccurate results. Start the timer. Immediately after removing the excess urine, start your timer. The timing is crucial, as each reagent pad on the dipstick is designed to be read at a specific time. Read the results. Hold the dipstick horizontally and compare each reagent pad to the corresponding color chart. Do this at the precise time specified for each test. Match the color of the pad to the closest color on the chart to get a result. Note that you must read the dipstick within a specific time for accurate results. 4. Recording and interpretation of results. Document findings. Record the results for each test: pH, specific gravity, protein, glucose, ketones, nitrites, leukocytes, in the patient's chart. Note both the patient's identifying information and the date and time of the test. Interpret results. Understand the meaning of each test result. For example, the presence of nitrites and leukocyte esterase can be a strong indicator of a urinary tract infection. The presence of glucose may suggest diabetes. Disposal and cleanup. Properly dispose of the used dipstick and any other contaminated materials in a clinical waste bin. Communicate with the patient. If appropriate, inform the patient that the test has been completed and provide a brief explanation of the findings.